In the U.S., every 3 minutes, someone dies from a stroke. But did you know it is also the #1 cause of disability in adults? More than half of stroke survivors over age 65 have reduced or permanent disability, and treatment options are limited. Until now. Senior health correspondent Monica Robbins shows us a groundbreaking surgery bringing hope to people.
For 53 years, Tommy Fello called his namesake restaurant his sanctuary.
Take care of yourself, enjoy.
But everything changed on Christmas Day, 2023.
Driving home, all of a sudden the truck started going to the left.
Tommy suffered a devastating stroke, paralyzing his left side.
Holding on, good job.
The months that followed brought grueling physical therapy, but like many stroke survivors, progress heartbreakingly slow.
Yes, I appreciate it.
There was one silver lining. His devoted employees stepped up to save the business he'd built. Then he discovered a groundbreaking new surgery at Cleveland Clinic.
He's so motivated that we thought we'd give it a shot, and I think we're glad we did.
In a 1-hour outpatient procedure, Dr. Bain implanted a pioneering device in Tommy's chest. It sends electrical pulses to his vagus nerve, helping his brain rewire itself and form new neural pathways. Activated during rehab, it's designed to restore upper limb function. And for Tommy, it's working.
The flexibility of my hand, even though it's passive, I have to use it with my right hand, is getting better and better. I'm more loose. And then even last night, for example, my hand is opening up on its own.
The transformation has been remarkable. Tommy can drive again, climb the stairs to his office, and reclaim the simple dignities most of us never think about.
Taking a shower, washing your face, shaving.
What makes it even more promising, the surgery can be performed years after a stroke occurs.
So basically, just have to have upper extremity weakness and have had a stroke, and it could be at any time, usually 6 months. But I think our latest patient we implanted was 3 years.
But the device isn't a miracle cure. It requires intensive rehabilitation.
But when you look back at the beginning, you couldn't even get off the bed. So you always have to realize how far you've come.
The man who once worked 15-hour days now savors time with customers.
Take care of yourself. Have safe travels, okay?
And more importantly, precious moments with family.
Nothing's more important than family. And it took a stroke to make me remember that.
Across the nation, less than 1,000 patients received the device for stroke rehabilitation, and many of those cases are recent, meaning we don't have long-term data on how recovery is going. What we do know is many, like Tommy, are seeing improvement, some more than others. If you're a stroke survivor and you think you might be a candidate, talk to your healthcare provider and reach out to Cleveland Clinic's Cerebrovascular Center for an evaluation. In the studio, Monica Robbins, 3 News.